So the first one we're going to do is a scaphoid. I'm going to do a lateral to medial or a medial to lateral tissue pull. I'm going to flex the wrist. It's going to be a thrust, it's P to A. And then for the triquetrum, I'm going to do a lateral to medial tissue pull, flex the wrist, and it's going to be a P to A. And then for the lunate, I'm going to flex the wrist to about 30 degrees. I'm going to grasp their hands with my dip and pip, whatever they are. And I'm going to give a quick thrust, and that will be A to P. The next one that I'm going to do is going to be the distal radius and ulna. So I'm going to grasp the patient's distal wrist, and with my lateral hand, I'm going to be squeezing the radius and the ulna together while distracting the wrist. The next one is going to be the thumb, or the carpal metacarpal. Now with my lateral hand, I'm going to grasp the patient's hypothenar, and with this hand I'm going to grab, and it's just going to be a pull. Then the next one that I do is the carpal spread. With this one, how I'm going to do it is I'm going to contact the dorsal aspect of the patient's proximal row of carpals, and then my thenars are going to be on the posterior aspect of the carpals. And how this works is I'm going to push A to P with my fingers while pulling M to L with my thenars. And I do this about 5 times. Then the last one that I do is the distal row carpals. So what I'm going to do here is I'm just going to grab here at the distal wrist, the distal radius and ulna, and then I'm going to locate the first metacarpal, which deals with the trapezium because it goes to the thumb. Cool beans. I'm going to pull, distract, and then give a quick pull. And this one deals with the capitate. Distract and then grab a quick pull. And this one deals with the lateral aspect of the hamate. Pull the ring up a little bit. And then this one deals with the medial aspect of the hamate. My wife obviously likes to pop her fingers because there's no popping sound. And that is the wrist.